I was fortunate to attend Jefferson, now Sidney Kimmel Medical College. And as a Jefferson medical student, I was able to work frequently with the Wills doctors and shadow at Wills Eye. And in truth, I fell in love with Wills before ophthalmology. As a medical student, Wills was this surreal hospital where all the doctors seemed really genuinely happy, where cutting-edge procedures were being performed routinely, where strong, smart women held major leadership roles, where world-famous Dr. Carol Shields knew me and would part the sea of her observers to make sure that I was able to get a view of the rare exam findings. I spent 3 exciting and intense years training here at Wills with some of the best teachers in the world. So as an ophthalmologist, I get to work to give you the best vision possible. But as a Wills Eye ophthalmologist, I get to do all that, but with the best doctors, staff, and technology available anywhere.
Wills is the epitome of skills, compassion, and teamwork. And at Wills, I think we do it better than anyone else. This is a master puzzle of specialists in various fields of ophthalmology that work together seamlessly to give the best patient care for each and every patient. Not a day goes by that I don't call someone on the retina service, the cornea service, the plastic service, the neuro service regarding a patient that they can see right away, and we get everything wrapped up neatly for the patient in a one-day community of teamwork. I've enjoyed every minute that I've spent here at Wills, and I'm very proud to be a Wills Eye doctor.
Well, when I was a medical student at Columbia, I looked around at all the different residency programs, and Wills was either one of the highest, if not the highest ranked residency program. So I became a resident at Wills, and then I did a fellowship in cornea in Iowa City, Iowa, but my dream was to come back to Wills. And the question is why, and the answer is, Wills is just a special place. It's a special place for patient care. I think no other place in the world has better patient care than we do. And it's a special relationship with the other doctors at Wills. I mean, there's a term, the Wills family, which can sound corny, but really is what we're all about here. If I see a patient and I need them to be seen by a retina doc or glaucoma doc or plastics doc or oncology doc, I can call them up and say, hey, can you take a look at my patient today? And they may be very busy, but they will always see that patient that day, and they will take excellent care of them. I mean, I know that my patients will get excellent, not only cornea care that I and my partners give, of course, but whatever care they need for their eye in a wonderful setting.
Why Wills Eye? Well, I'm not one of the lucky ones who was born at Wills Eye Hospital, unlike most of the other faculty here. I'm an adopted family member, and I was lucky enough to get to come here later in life. It's kind of like being in the football business or the baseball business, and you get called up to the major league. So I got called up to the show and got to come to Wills 10 years ago now, and it was the chance of a lifetime for me to come here. Again, I'd have to say it comes down to the people, incredible people, phenomenal place, and the opportunity for me to build on this great history and tradition and help take the place on a new trajectory into the future was very exciting. I couldn't pass it up, and it was the best decision I ever made.
So in Wills Eye, I found a wonderful combination of excellent clinical practice, lots of pathology, excellent trainees to work with, and wonderful research opportunities. And these are all things that I find very meaningful in my practice, and that's why I was drawn to Wills.
Well, Wills Eye Hospital is world-renowned. Actually, when I came here to do my cornea fellowship, it wasn't so much for Wills Eye Hospital. It was mostly because of the person involved here. It was Peter Lapson, who was my mentor for many years. Juan Aronson also was a mentor. He was Dr. Lapson's junior partner. But once I came here at Wills and saw how wonderful and magnificent it was, world-class, everything, and you could bounce ideas off any world expert in any field of ophthalmology. It really hit home what a great, fantastic place this is and how Philadelphia is lucky to have it.
I have to admit, when I was a medical student in Virginia, not being from Philadelphia, I did not know much about Wills Eye Hospital. But the residency director at my medical school encouraged me to apply to Wills Eye Hospital. So once I came up for my interview here, I just instantly fell in love with it. It's world-renowned, as everybody knows, but it was a family-type feel where all people shared information and collaborated, worked together, and the patients got amazing care. So fortunately, I was lucky enough to get a spot here as a resident, and Wills has been my home ever since.
Why Wills Eye? I think among all the programs that I had the privilege to interview at after medical school, or at the end of medical school, Wills had a special feeling. There was just a camaraderie, a sense of we're on a mission together to do this. The residents and the faculty were very appealing intellectually, socially as well. I was lucky in that two of my predecessors at Columbia Med were residents here, Chris Rapawano and Ann Chen, and I think they really paved the way for me.
Wills Eye is the best place to be. You know, it's growing up, I grew up just outside Philadelphia. I'd grown up hearing about Wills Eye. I had interviewed here. I did rotations here at Wills Eye as a medical student and resident. And it's the collection of the best people in ophthalmology, and why would you not want to associate yourself with that group of people? The guy that does the videos is awesome.
Wills Eye, I'm sure you're here in many of the interviews from the doctors here, is really like nowhere else in this country or even the world. It's really like an extended family, and I think the colleagues that I have here are really not just colleagues but friends and extended family, I would say, as well. I was a resident here, so I really felt that connection. I remember on my first interview day here, I could really feel that, and I think that feeling hasn't gone away. And so I enjoy being with the residents now and giving back like so many that had given to me and taught me during my residency years.
Wills Eye is a very special place. I was fortunate enough to do my retina training here in fellowship, and is fortunate again to be able to return as an attending. It is a unique place because under one roof there are thought leaders, there are outstanding clinicians in all of the subspecialties of ophthalmology, and we can do so much collaboratively both on the research end and clinical care end and surgery end of the spectrum to help patients. And I can't imagine a better place for patients to be with unique and complex eye problems, but also just a better place. I can't imagine a better place to be, and I've experienced it firsthand, both as a trainee and as a practitioner here at this institution.
You've probably heard this over and over again in your interviews, but I chose Wills Eye because of the commitment to excellent care that this place has for our patients. There are so many world-renowned experts under one roof here, and everybody has the same goal, to make our patients see as clearly as possible. Everybody works together, everyone's very collegial, it's a great atmosphere. And the trainees here are some of the best in the entire country, both residents and fellows, and it's an honor and a privilege to be able to teach them and to see them grow into excellent ophthalmologists down the road.